So welcome to this video about the reconstructive ladder. So the reconstructive ladder is a core concept in plastic surgery that helps you understand how plastic surgeons close wounds. And it answers the question, given that we've got this wound, how is it going to heal? And I like to think of it in three principal steps: closure, graft, and flap. And these are organized in this way due to increasing level of sort of involvement and complexity. So this is intended as a conceptual guide and an educational guide, and it is certainly not intended as a guide to treating patients. So please do not take it as such. So take this as a way to understand wound management and understand the reconstructive ladder, not as a clinical guide. So this is the thumbnail again, and you know I always deliver on the thumbnail. So this actually shows the three different steps: closure, graft, and flap. We're going to talk about what each of them mean. And this is an AI generated image, and this video contains a lot of AI generated images. Some of them are very good, some of them are okay, and some of them are just straight up terrible. And I have included all of them, first of all, because some of them are actually very useful ways to explain things, and other ones are useful for us to explore the limitations of AI in creating images for the purposes of medical education. So not only is this not intended to help you treat patients, this is also highly experimental. So the entire utility of this video could be called into question. Anyway. So this is once again the reconstructive ladder, and let's start with closure techniques. So I'm going to present four different methods of closure. The first one is healing by secondary intention, then healing by primary intention, then vacuum-assisted closure, and then healing by the so-called tertiary intention. And we'll go through all these in turn. So this is secondary wound healing. So and this is actually a really good picture by ChatGPT. And so secondary comes before primary because secondary is less involved. So secondary wound healing occurs when the wound edges are not opposed and the wound is just left to heal on its own. Okay, so this is basically clean it, dress it, do nothing about it. Then we've got primary wound healing, which is where the edges are opposed and the opposition is maintained in some way. So it can, for example, be by suturing, which is probably the most common technique. It could also be by steri-strips or glue. So there's different ways of achieving primary wound healing, but the main thing with primary wound healing is you've got a healthy wound edge here and a healthy wound edge here, and they are opposed with no gap in between, and that allows for primary wound healing. This is the diagram originally created by ChatGPT about primary wound healing, and you can see that the edges are not opposed. So primary wound healing would not happen in this circumstance. This would heal by secondary intention. Then we've got vacuum-assisted closure, and this is actually a phenomenal picture by ChatGPT. I actually can't believe that it managed to create this. So vacuum-assisted closure is where you've got a wound bed and you apply this sponge onto it, attached to a vacuum, and that vacuum is sealed onto the skin by this sort of cling filmy tape sort of thing, and you flick the vacuum on and it sucks the air out of the sponge and creates a negative pressure chamber inside here. And what it does is it encourages granulation tissue formation, and it encourages the wound edges to come closer inwards. So it helps speed up wound healing in that way. And I've mainly seen this used for wounds that are very big and that are not that cosmetically important because it leaves a scar. Then this is a diagram by ChatGPT about vacuum-assisted closure where you've got apparently maybe some necrotic tissue here, hypergranulation here, and a vac device that doesn't fully cover the wound. So that's all kinds of wrong. Then we can talk about healing by so-called tertiary intention, which is not entirely a technical term, but it helps you understand what it is, because ultimately it heals by primary intention. But let's explain how it works. So you start with a chronic wound, which is, it's like sloughy and all that, and it's not healing on its own. So a wound that's not healing on its own. And then you excise that wound. So excise remove all the exposed tissue here in an elliptical shape, and then you close that with sutures or steri-strips or tissue glue or some form of closure that allows for tissue opposition of both sides and allows for primary wound healing. So it's the conversion of a chronic wound into an acute wound and healing by primary intention, but it's sort of called tertiary intention, just sort of for memory purposes. This is the diagram originally made by ChatGPT, and it looks more like a full thickness skin graft harvest site, which we'll talk about in a minute as well. And the problem with this is it's not so the corners aren't sharp because the corners are rounded. What that would mean is when you put stitches all around here, the edges would lift up and cause these sort of dog ears, as they say, and it would not look very pretty when it heals. And now we've covered closure, let's move on to grafts. So a graft is a piece of tissue that relies on the blood supply of the site of implantation, whereas a closure technique is where the wound is managed without extra tissue, without bringing any sort of extra tissue into the game. So we're going to talk about two different types of grafts, split thickness skin grafts and full thickness skin grafts. You could graft a lot of different tissues. So you could graft tendon, you could graft bone, and then you could add other things like skin substitutes and xenografts and all those sort of things that are grafts, but they're a bit too fancy for this video, so we're not going to cover them in this particular video. So this is a diagram of split thickness skin graft, and I found it very difficult to create a split thickness skin graft image with ChatGPT, and this is the best I got, and this still has limitations. So basically, a split thickness skin graft is where you take epidermis and some depth of dermis, but not the full depth of dermis, because you leave some dermis behind so that it can heal from the from like the sweat glands and hair glands and things like that, and the epidermis sort of rises from those pits and spreads around the and to allow it to heal without strictly healing by secondary intention. So I think it is technically secondary intention, but it just heals faster this way. So basically what you've got is this device that shaves off partial thickness of skin, and you've got this this bit contains epidermis and part of dermis, and the rest of the dermis is left here. The problem with this is it should take the graft along the full length of the device rather than just this half. So this looks like perhaps there's some of the graft has gotten stuck there, so this the person operating this should have really stopped already, I think. And then we've got a meshing device, which if used incorrectly can turn the graft into just spaghetti, which is to be avoided. And we've got a floating wound bed in midair, a gift from ChatGPT. Then basically the split thickness skin graft is then sutured onto the wound and sutured onto the edges of the wound, and it's allowed to stay there without moving it about because shear forces can cause it to fail. And this looks like a massive split thickness skin graft here and a smaller elliptical split thickness skin graft here, which doesn't fully make sense to me because normally you'd have like normal skin and then an area covered by a split thickness skin graft. So this is not completely this diagram once again has its own limitations. Then let's talk about a full thickness skin graft. So this is where instead of using a device to shave off a partial thickness of skin, you use a knife to take out a part of skin, and then the edges of that are opposed and closed with primary intention, and the piece of skin that's taken off is implanted somewhere else. And you take epidermis and the full thickness of dermis for that, and you try to take none of the fat with it, basically. And the donor site has to be one where you can oppose them. This looks like it's at the knee. It's a bit bizarre it's probably not correct to take it at this level. Although I'm no plastic surgeon, and if there's a plastic surgeon in the comment section that wishes to disagree with me, please do. We will find this will make for an interesting conversation. But this is at the knee. So if you take tissue at the knee and oppose the edges, that's going to tighten the knee and limit the range of motion of the knee, and that's probably no good. But the point is, whereas a split thickness skin graft takes only part of the dermis, a full thickness skin graft takes the full dermis, and instead of leaving it to heal on its own, it needs to be closed. Okay, and then it's placed onto this new place, and it's sutured. You know, the texts on this slide are remarkably good. Sometimes the text is really like completely wrong, so it's really hit and miss how well ChatGPT does this, but here it's done it really well. But I think the donor site decision by ChatGPT could potentially be criticized. So we've talked about grafts, and now it's time to talk about flaps. So a flap is a piece of tissue that brings its own blood supply, whereas a graft does not bring its own blood supply. It relies on the blood supply of the site of implantation. And we're going to talk about 3 different types of flaps: local flaps, pedicled flaps, and free flaps, all sort of getting more involved as we go. So this is a V to Y local advancement flap. So perhaps there's like a skin cancer here that's been removed, and then what they do is make incisions here and incisions here, but the plane underneath this tissue is not developed too much, so it's left intact, so that any perforating blood vessels that are here are intact, and then this piece of tissue is moved forward so that this edge is opposed with this edge and sutured together, and this edge is opposed with this edge sutured together, this edge with this edge sutured together, and then these edges are opposed directly and sutured together, and you start with a V shape and you end up with a Y shape. And it's called an advancement flap because it's advanced forward. Okay, and it brings its own blood supply because there's these perforating vessels all throughout here that supply this bit of skin. Of course, you'll get collateralization. You'll get capillary formation at the edges, but this central bit of skin is supplied by these perforating vessels. Then this is a diagram depicting a lat dorsi flap, which is a pedicled flap, which is a myofasciocutaneous pedicled flap, where you basically make an incision with and you take skin, fat, fascia, and muscle, all supplied by an artery and a vein that are identified. You make a tunnel between the armpit and the breast, and then this piece of tissue is pushed through that tunnel underneath the skin into this breast area and stitched into the skin, and then the blood vessels that used to go this way now go this way and supply that piece of tissue. So that's a pedicled flap. So the pedicle is sort of swung with it onto that side. And this is ChatGPT's attempt at displaying a lat dorsi flap. So this is, I don't even know where to start. I find it weird because when I do anatomy revision, I can sometimes use ChatGPT to ask really detailed anatomy questions with a lot of implied context given with the question, and it's able to give a good technical answer, which, by the way, always worth double checking if the answer is correct or not. But it doesn't seem to be able to combine image generation with anatomical reasoning, which is a bit annoying. But anyway, perhaps that's to do with the fact that it doesn't really reason, it perhaps just imitates reasoning. Then we have a Dieppe flap. So this is a free flap. So basically, you take a piece of skin and fat, and you supplied by arteries and veins, and you take them and you cut the arteries and veins and tie them off here or ligate them somehow, and you take all of that and put it in there, and the arteries and veins that are brought with that piece of tissue are reanastomosed with arteries and veins here. So this is a free flap. So this is where the blood vessels are removed and reanastomosed at the site of implantation. So that's a free flap. Okay, and this is what ChatGPT told me when I tried to ask it to create a diagram of a Dieppe flap. It basically said that it's against the user policy, and the reason for that is that it had to depict a breast, and that's not something that ChatGPT is allowed to do. So anyway, that's basically the video done with closure techniques, grafts, and flaps. Okay, so closing a wound without bringing extra tissue, then bringing extra tissue that relies on the donor site blood supply, on the blood supply at the site of implantation, and then bringing tissue that is able to bring its own blood supply. And this is how you can think about wound closure on a conceptual level, and this may be useful for your exams. My name's Arrow. I'm a doctor in the UK, sort of SHO level, and I am quite fascinated by medical education, and I'm planning to make more of these videos in the future. Right now, the sort of content bucket that I'm trying to fill is this sort of principles of surgery videos. So videos that explain how to think about surgical concepts. Like the last one was about the 5 modes of plating, which explains how different sort of plates in orthopedics works. And this is a foundational concept in plastic surgery, so the reconstructive ladder. And I'm planning to make more of these videos in the future. If there's some concepts that you find difficult, please put a comment in the description and tell me what you would like to learn about, and I might just be able to make that video for you. Okay? My name's Arrow. Thank you for listening to and thank you for watching this video, and see you again next time. Bye bye.